my name is Julie Reynolds and I'm going to demonstrate the equipment necessary for induction of a PET for anesthesia. First of all, we have the anesthetic machine. It can either be circle or non-rebreathing. Right now I have it attached to a non-rebreathing system because the PET is less than 20 pounds. If I wanted it to be circle, I would take off the non-rebreathing system, put the F-air canister attached there, and make sure it's all hooked up properly. We do check the anesthesia machine for any leaks prior to induction of anesthesia each time we use it. It is attached to the oxygen tank. You can see that the oxygen is turned on. On the anesthetic machine for quick use, we have a syringe that we can use for inflating the endotracheal tubes. There's also eye lube. So once the PET is induced, we put this Paralube vet ointment into the patient's eyes. I have an endotracheal tube that we have previously determined is the proper size for the PET. We have the end lubed, and we also have a laryngoscope to help with the intubation. We have a mask for pre-oxygenation. We use this prior to induction of anesthesia to make sure that the PET is pre-oxygenated for 5 minutes. We also have a blood pressure cuff picked out for the size of the patient, and this which monitors the pulse and the SpO2 that's attached to our heart rate monitor and blood pressure monitor. We also have ties so we can tie the patient to the table. There's 4, one for each leg, and a towel for moving the patient. And on the endotracheal tube we have this gauze that we use to secure to the patient, so that once we place the endotracheal tube and then inflate it, we can make sure it stays at the proper depth, and the PET is properly intubated. We also do keep a couple spare endotracheal tubes next to it, one that are a couple larger in size and some that are a couple smaller in size, just in case the endotracheal tube we chose did not fit the patient well. We do check all of our endotracheal tubes prior to intubation as well. So with that we have flush. So flush our induction agent, and then we flush again to make sure the induction agent goes into the PET, which I will demonstrate in a later section.